this is Melissa. I am here today doing my dry run through for my bitch catheterization. So I will just show you that I have all my materials together here. I have my urine tubes in a sterile specimen container, my syringes for collecting my urine sample, and I've got a 12 here I'm just going to crack and have ready for when it's time to attach it to my catheter. Cards, I've got my little speculum tip. I also have here a 3.5 as well as a 5 French catheter, and my nice warm water, Hibitane, and some gauze for my prep. So I'm going to start with just clipping my dog's tail off to the side, and I'm clipping hair to hair to make sure that it's not tugging on their skin or making them uncomfortable. And this dog is pretty good, nice short hair, so I'm not going to worry about clipping it, but if I had a long-haired dog, then I would just shave up a little bit to make it a little bit easier. I've pre-moistened some gauze here so that I can use a little bit of chlorhexidine to scrub up. And scrub and rinse. And scrub. And rinse. And my third scrub. And my final rinse. And I have Tara so wonderfully restraining my puppy here for me. There we go. So now she's all scrubbed and she's nice and comfortable. I'm going to come over here and just use the same soap and just give my hands a nice quick wash, the 30-second scrub here. Paper towel. So now I'm going to take my catheter and just pre-measure and get an idea of about how far in I want to take it. And I think she's a medium-sized dog, so I think I can get away with using the 5 French, so I'm going to try that. So it shouldn't be very far. She's not a very big thing, so we'll just use, if I figure probably about a third, maybe even a quarter of the catheter the way in, I should be getting urine back. So I'm just going to open my catheter and get it all ready. Thank you, Tara. They're usually quite springy when they're coming out of here, so I'm just going to try it. Open it so it stays on the packaging here. Alright, so my catheter is now opened and my patient is prepped. So I'm going to take my speculum Oh, thank you. Oh, I should probably put that, just a little dab of that on my...
I was moving it to the right. I thought it would be easier for you.
Thank you. There we go. So I'm just going to put just a little drop of xylocaine jelly there. So now placing my speculum, I'm going to come in dorsally and then go cranially. So I will come in, you look for the vulvar opening, and just come in and go dorsal first, and then cranial. And then I'm just going to use my light source to see if I'm in the right spot. And I'm visualizing and I'm looking for the little red fold flaps. So like in the video she said you can go first quite cranially and then draw backwards to see if you can, you just pull back and you're looking for it as you're pulling back. So I'm looking and I'm visualizing this way, and I can see the urethral opening on the ventral aspect. So then I know I can put my catheter in. The other way we were also told to check on this run was to do it digitally as well. So the same thing for digital. We're going to come in with our nice clean hands because we've cleaned our hands and spread the hair and washed this area. So same thing with our finger. We're going to come into the opening, the vulvar opening, dorsally and go cranially, and then pulling back, feeling with our finger, we're going to feel for where we feel the little dip, the little divot, the little spot on the ventral aspect of the wall, and that will be the spot where we will tip our finger down and advance our catheter. So I've shown you both ways that we would look and visualize for the urethral opening. So I'm going to go back to my visualization technique to actually place the catheter. So again, come in dorsally and go cranially. And with this technique, quite often you need someone to hold the light source for you so that you can see down there.
Yeah, just open it right up.
There we go. There we go. So actually, Brianna, would you be able to just put a hand here and, oh there, Tara's wonderfully holding on to my light source. So then I'm going to take my catheter and I'm going to grab this back side so I have control, and using my sterile gauze, I'm going to grab the tip so it stays nice and sterile. I'm going to just dab it into my xylocaine jelly so that it's, and then using my light source, I'm going to feed it down the speculum through the sterile speculum. And visualizing, watching to get into the bladder for my pre-measured area for when I get urine back. And because I've put a syringe inside of my stuffy filled with iodine and water, I'm just going to take my So I'm just going to attach this first to remove my first 2 mils. There we go. So there's 2 mils there that I'm going to discard. And then I need 6 mils of sample. So I've pulled back to 10 just to make sure, and I'm just going to put that into my syringe case for the moment to make sure it stays nice and sterile. And then I'm going to carefully remove the catheter and the speculum. And the catheters we just discard, we don't clean up or reuse. I'm just going to check my patient and make sure she's still clean. You know, she might need a little extra cleanup there, just the xylocaine jelly and the catheter and everything. I'm going to unclip her tail because she was such a good patient. Tara's going to take her now and return her to her kennel or take her out for a little pee just in case we stimulated that bladder and she might need to urinate more. Then I'm going to clean up all of my stuff, and I'm going to get my sample ready to be sent to the lab for urine culture. I set my tip up so that it's not getting contaminated. I'm running my urine in gently alongside of the glass tube. There we go. That back in, and I'm going to label this with the date, the patient's name, that it's urine, the time it was taken, and which lab it's going to, which test it's supposed to be run for, and it's going to go into the fridge right away or get packaged with ice to be shipped out, since it's got to be either processed within 6 hours or off to the lab and chilled. So I have that, and I also have my patient file here that I'm going to write the date on. Today is January 8th, 2014. We did a urinary catheterization using a 5 French catheter. Patient was very good. 10 mils urine collected. For culture, to lab at IDEX. Awesome. So, and then my initials. Okay. Great, so I filled out my file, my patient is taken care of. I'm going to continue on with cleanup and getting my sample to the fridge. And other than that, I will repackage some new catheters afterwards and see you for the next assignment.